Hello, this is Luis. Welcome to the HDTV updates from the European Society of Cardiology Congress 2022. Today we bring you Day 1 updates of ESC 2022. The ESC's annual Congress always issues new and updated guidelines, and this year is no different. Revised guidelines on ventricular arrhythmias and sudden cardiac death recommended that genetic testing and genetic counseling should be undertaken in patients with clinical suspicion or clinical diagnosis of catecholaminergic polymorphic ventricular tachycardia or CPVT. Beta blockers, ideally non-selective naloxone or propranolol, is recommended in all patients with a clinical diagnosis of CPVT. The 2022 ESC Guidelines on cardio-oncology is the first cardio-oncology guideline issued by ESC. Fernandez highlighted that the goal of this guideline is to assist all healthcare professionals who care for oncology patients before, during, and after their cancer therapies in terms of their cardiovascular health and wellness. The guideline lays recommendations on the definitions, diagnosis, treatment, and prevention of cancer therapy-related CV toxicity, as well as the management of CV illness induced directly or indirectly by cancer. Delcroix presented the revised recommendations of 2022 ESC Guidelines on pulmonary hypertension. Initial combination treatment with PDE5 inhibitors and ERA is advised in individuals with IPAH, HPAH, DPAH who are at low or intermediate risk of mortality. Initial combination treatment with PDE5 inhibitors and ERA and intravenous and subcutaneous prostacyclin analogs should be considered in individuals with IPAH, HPAH, DPAH who are present with high risk of mortality. The 2022 ESC Guidelines on cardiovascular assessment and management of patients undergoing non-cardiac surgery laid revised recommendations on perioperative management of antiplatelet and anticoagulants, and new recommendations on perioperative thromboprophylaxis. Regarding anticoagulant use, the guideline emphasized that in patients with a post-operative indication for oral anticoagulant, NOAC is generally recommended over VKA. Even routine use of beta blockers for the prevention of post-operative AF in patients undergoing NCS is not recommended. McDonald presented the results of the TIME study, which compared the effects of evening over morning dosage on CV outcomes. It was observed that allocating antihypertensive medicine to the evening dose did not improve the primary endpoint. Subsequently, patients can be instructed to take their antihypertensive medicine in the morning or evening because the timing has no effect on cardiovascular outcomes. Ray Kay presented a session on a decade of innovation, guidelines, and paradigm shifts in LDL-C management, where he emphasized that LDL-C lowering should focus on early combination therapy, just like the combination therapies used for BP reduction. The aim is to increase the number of available LDL receptors. Eventually, he concluded that multiple medications with synergy are now available to help accomplish LDL-C targets. This concludes our coverage of the HDTV updates for Day 1 of the ESC 2022. We'll meet again tomorrow. Have a good day.